Chief Environmental Health Officer Andre Worm says his belief is that if the water supplied to the taps was responsible, the cases of gastro will be much higher. He said further investigations must be done so that they can make the appropriate epidemiological association.
We cannot definitively indicate at this point in time that the gastro situation is due to Nawasa's water. We cannot make that kind of association as yet.
He said that in the process of investigation, water within the distribution system in communities where there are cases of gastro will be tested. WOM says it is standard practice that the Ministry of Health conduct weekly reviews on samples taken by Nawasa. However, due to constraints at the ministry, this was not done over the past couple months.
For a couple months, possibly. So I can tell you that, yes, there is need for us to do our own independent assessment.
He says, however, that Nawasa has its own internal quality control systems and says from his department's assessment, the water supplied to our taps is of good quality. Some persons have queried a possible linkage between the quality of water flowing through the taps and the outbreak of gastro. There have been reports of a shortage of alum and chlorine or changes in the formulation of substances used in the purification of raw water before it's distributed to the public. Our news desk brought the concerns about the possible poor water quality to Communication Supervisor at the National Water and Sewage Authority, NAWASA, Jamila Lewis. In response, she said the water safety is a priority to NAWASA. In a statement to GBN News, the company said, and I quote, NAWASA, as part of our routine operations, monitors the quality of the water supply. Our supply is consistently within the WHO international standards for drinking water quality, making same safe for consumption. To date, NAWASA has not been alerted by the MOH that there is any evidence of a link between the recent outbreaks of gastro and the quality of the supply of water. In light of this, NAWASA is unable to comment on any link between the quality of the water supply and the outbreaks of gastro. End of quote. WOM was asked if this concern was brought to the ministry's attention.
No, I cannot speak to the NAWASA's resources and in terms of whether or not their resources have been replenished or changed as the case may be.
Gastro, as it is commonly referred to, is an inflammation of the stomach and intestines, typically resulting from bacterial toxins or viral infection, and causes vomiting and diarrhea. The number of cases has already surpassed 1,000. Children under the age of 5 account for close to 400, while children 5 and over account for 887 cases. Cherry and Blackman Stephen, GBN News.